This is SURGUCATION, surgical education for parents. We are here to inform, inspire, connect, and heal.
Undescended Testicle, SURGUCATION Episode 10. Dr. Hans Pohl, Chief of Urology, Children's National Hospital. Hi, welcome to SURGUCATION. This is Dr. Michael Petrosyan. I'm your host. Today we have Dr. Hans Pohl, our visiting guest. He is Chief of Urology at Children's National Hospital, and we're going to talk about undescended testicle today. Also used to be called orchidism, but the term is a little bit too complex to pronounce and understand. So I think most of us understand undescended testicle as it is.
Yeah,
testicle that hasn't descended into scrotum.
Well, few of us speak Greek anymore, so that's the problem.
True.
Yeah.
Well, welcome to SURGUCATION. Thanks for being with us today.
It's a pleasure to be back.
I have some questions for you, and hopefully we'll be able to clarify this to many parents that are listening or have kids who have undescended testicles.
And I have the answers to all of your questions,
Awesome.
Michael.
What is the undescended testicle, and how do you know that your child has undescended testicle?
So first, for people to understand, what generally happens in just about the last 4 to 6 weeks of development is that the testicles, which are forming in the abdomen, actually close to the kidneys, will begin to descend into the scrotum. And they do so by following a pathway through the inguinal canal or the groin, and make their way into the scrotum. And once they arrive there, that canal is closed. The testis is supposed to stay in the scrotum from basically birth. And in some few boys, that process stops part of the way, and the testicle will be either in the belly or in the groin and does not complete its descent.
So the child with undescended testicle comes to clinic to you, to visit you guys. How do you diagnose it, and is there any test that you need to do besides physical examination?
Generally, it's pretty easy. If the boy has 2 testicles in the scrotum, then pretty much you know that there's no problem there, right? But if the boy has 1 or both of the testicles not in the scrotum, then that child is going to need some kind of exploration or surgery to look for, find, and then bring the testicles down. So as a result, there is not much imaging at all that's required. So at this point in time, it's generally a diagnosis made by physical examination. There may be a couple of circumstances where a sonogram can be of help. And my practice now is that I would use it in a boy who is perhaps very overweight, and it makes it difficult for me to locate the testis in the groin. But short of those circumstances, even the American Urological Association has said that sonography has no real role anymore in the diagnosis of undescended testis.
So what if you don't treat the undescended testicle? You just happen to not notice it and it goes untreated.
Well, the problem with not treating an undescended testis is that the testis is supposed to be in the scrotum in order for the cells that are ultimately going to become sperm-forming cells to actually mature properly. And so if the testis is located in an abnormal position, those cells will slowly die over the course of the 12 years. And by the time the boy enters puberty, few, if any, of those cells remain, and that testis will not make sperm.
So how do you, you diagnose undescended testicle, how do you actually treat the undescended testicle?
So as I mentioned before, it's a surgical condition. So the only way to treat the undescended testis is to perform an incision, loosen the tissues around the cord of the testicle and the testicle that are holding the testis in its high place. And by removing that tissue, the cord relaxes and it allows the testis to naturally fall into the scrotum. We usually put a suture or a stitch in place to make sure that the testis stays there while it's all healing. And all of the sutures we use are dissolvable, so after about 6 weeks, the testis has just essentially glued itself into proper location.
I'm going to go a little bit complex. Maybe some parents have kids whose testes are in the abdomen. Mm-hmm. I know there's two-stage procedures as well. What happens when the child's testicles are actually in the abdomen? They haven't descended in the
Right.
to the scrotum.
So it's relatively straightforward to make an inguinal incision for a testis that is in the inguinal or the groin canal. But when the testis has not exited the abdomen, then we need to use a laparoscopy, which includes a camera and 2 other instruments to loosen the attachments between the testis and the inside of the abdomen, and then to push the testicle down. There is some debate in the pediatric urology community as to whether that should be done as a 2-step or a single-step procedure. The large studies have found that if it is performed in a 2-step operation, the success rate is slightly higher for being able to bring the testis down and having it survive its descent. But the increased success rate is only perhaps about 10%, and so it becomes then a conversation that one needs to have with the parents as to whether they would prefer to have 2 separate surgical procedures for a very slight increase in success.
I know, reading the literature on internet as well as looking back where I did my medical school, we used to get told that if you have an undescended testicle, the incidence of cancer is much higher in those kids. I know that has changed. Why don't you tell those parents who have kids with undescended testicle, what are the incidence of cancer?
So the first thing I tell parents is any boy that has testicles has a risk of cancer, because by virtue of having testicles, you have a risk of cancer. And so the question is if that testis is in a slightly abnormal position, what is the increased risk over that baseline risk? We used to be taught that the undescended testis has a 30 or 40 times greater risk of testicular cancer, which was really kind of a scary number when one thinks about it from that perspective. Having done this now for 22 or so years, I have never taken care of a testicular cancer in a previously undescended testis. So it's unclear exactly where those old numbers came from. In a more modern series out of Sweden, they reported their rate of only about 2 to 3 times greater, and I think that those numbers are probably more real. So I think that there is a concern, but I don't think the concern is as great as we once thought it was.
So let's say the parents have a child with undescended testicle. How do they prepare for the operation? And what is the age they should normally get that surgery done?
Well, if the testis is not descended, it should be brought down as soon as possible. Now, I don't want parents to leave thinking that it's an emergency and they need to go to the operating room the next day after the diagnosis. We clearly have enough time to prepare the family and the child to undergo the general anesthesia and the surgical procedure. So what I would say is that if the testes are not in the scrotum by the time the child is 6 months old, then you know that those testes or that testis is not going to come down by itself, and the child is a candidate for surgery. So they should seek either a general surgeon or a urologist who's capable in doing that kind of surgery, and then bring those testes down as soon as is practical.
So what are the expectations of parents after the operation? What
So-
should they expect, pain-wise, activity-wise?
What's really incredible is that, as you know, as being a skilled pediatric surgeon yourself, that we can do all sorts of procedures on tiny children and they recover extremely well. And undescended testis surgery is one of those. Most of the parents that come back to see me a couple of weeks after surgery will report that their child goes back to normal activity by the day after the operation. I think that's generally true. For instance, if it's a baby under 1 year of age, they're not playing tennis or golf, so generally they're basically doing their normal little baby thing the day after surgery. And if it's an older child, usually they're already in the position to want to jump off rooftops, and so we actually have to tell parents to just keep the kid calm for a couple of weeks to ensure proper healing. So kids recover extremely quickly.
Awesome. So I guess the lessons learned from parents would be that undescended testicle is a surgical problem. It can be easily fixed. It should be done by 6 months of age. Increased risk of cancer twofold, but not 30 or 60 like it used to be.
That's
told
correct.
And on internet, some of the information on internet as well.
That's correct. Be
All
careful
right.
where you get your information these days.
That's true.
Exactly.
All right. Well, thank you very much. That was awesome. Hopefully many parents will learn from this podcast. And you're welcome to come back and tell us more about urology.
I'm always happy to come back.
Thank
Michael.
you very much.
Thank you very much.
Have a good day.
All right, bye-bye.